Glucose levels are 17, probably from that misdose, but ketones are okay. Has type 2 diabetes for over 20 years.
So 1 in 5 hospital beds are occupied by people who have diabetes. We know that diabetes patients tend to have longer hospital stays, and by 3 or 4 days on average. So our ultimate aim is to optimise their diabetes control so that their length of stay isn't prolonged due to their diabetes. Encompass has enabled us to look at patients, identify patients at the front door, so ultimately we can optimise their diabetes.
I find Encompass has been really revolutionary too in terms of how we're doing things. In diabetes care, we used a lot of IT systems, but it was quite convoluted getting the reports and how we identify our patients at the front door. We also then use our handheld devices, the mobile apps, to look at their orders, their prescriptions, their insulin prescribing, their glucose levels, so we can get updated live information on that person with diabetes right at the bedside.
The huddles enable us to look up information on the patient, identify the treatment that the patient is on, we can look at their glucose levels, see perhaps if they're on steroids. It speeds up the process and makes us more efficient as a team.
It's allowing us to have a much more multidisciplinary approach to the persons with diabetes when they're admitted to hospital. The only way of using the system to its full potential is by working together as a team and sharing that information. I think patients are going to be more involved in their care going forward with this system. The My Care app is allowing us to communicate directly with persons with diabetes. Insulin safety, much improved. I would say proactive identification of high-risk patients, much improved. And I would say patient communication through the My Care app has a lot of potential there that we can optimise. I wouldn't go back, it is improving diabetes care.